I get asked about hair loss on GLP-1 medications every single day. I'm Dr. Gordon, board certified in obesity medicine. Here's the pattern I see. A woman starts semaglutide or tirzepatide. Weight comes off quickly. 2 to 4 months later, she's finding hair in the shower drain. This has a name, telogen effluvium. Hair follicles cycle through phases: growth, transition, rest, shedding. Rapid weight loss shifts follicles out of the growth phase prematurely. They move into the resting phase early. 2 to 4 months later, the hair will shed. The same pattern occurs after bariatric surgery. The trigger really is how fast you lose weight. Medication makes it faster. The follicle responds to the physiological stress of rapid change. There's a second driver. GLP-1 medications reduce appetite by a lot. Caloric intake drops, and when intake drops without careful attention to nutrition like iron, zinc, vitamin D, B12, and protein, they can all fall short. Each one of those nutrients is required for normal hair cycling. In clinical trials, hair loss occurred in about 3% of patients on semaglutide and 5% on tirzepatide. At higher doses, rates were higher. Women were affected more than men. Hair loss typically begins about 2 to 4 months after rapid weight loss starts, and it resolves within 6 to 9 months once the loss rate stabilizes. What can you do today? Well, keep your protein at or above 1.3 grams per kilogram of ideal body mass per day. And if you don't do metric, that comes to about 0.6 grams per pound of ideal body weight per day. And I usually recommend about 100 grams of protein per day on average for women. Micronutrients matter. I screen and correct for iron, zinc, vitamin D, and B12 deficiencies. Slow weight loss. We usually use about 5% per month as a clinical baseline or benchmark. And if someone is losing more than that, we need to take a closer look. Obesity is a chronic disease requiring longitudinal long-term management. Hair loss is a signal to examine your nutrition and rate of weight loss. The good news is hair loss resolves, and the patients who manage it best are those paying attention to nutrition and muscle mass from day one. Follow me for obesity medicine grounded in physiology, not blame.